Myself Jayanti, I am from Warangal. Actually, I have a problem of Achalasia cardia, which was identified by Dr. Bharat Kumar sir. He did surgery to this, it is called as through poem surgery. Now I was feeling well. Actually, we joined here. The next day, the surgery was done, and the day next to the surgery, we was discharged. The surgery was done in 1.5 hours. The staff was actually very good. They are doing in the time and they are very well experienced, I think so. Doctors are also very good and they identified the problem which was not identified in my locality. I thank Yashoda hospitals. They are doing very well to the people. Thank you to Bharat sir. He cooperated very well with us. Thank you sir once again.
Hello everybody, I am Dr. Bharat. I am a medical gastroenterologist from Yashoda Malakpet. Today I am going to tell briefly about a good procedure that we have done recently. This is about a lady named Jayanti. She is from Warangal. She was referred from an ENT surgeon for symptoms of difficulty in swallowing for the past several months. So on evaluation here, she was found to have a condition called Achalasia cardia, wherein the muscles at the junction of the food pipe and stomach get very thickened. They don't relax while swallowing food. So this condition is called Achalasia cardia. So for this condition, I diagnosed it with a test called esophageal manometry, where we assess the pressures in the esophagus and the muscle at the junction of the food pipe and the stomach. So for this condition, namely Achalasia cardia, in previous era we used to do something called endoscopic dilatation, wherein we inflate a balloon in the junction of the food pipe and stomach to cause rupture of the muscles. So that procedure is kind of outdated nowadays because it has a risk of causing hole in the esophagus. That's called perforation. The risk of it is around 5%, which may require emergency surgery. So the second option for this problem is usually laparoscopic surgery, wherein we do laparoscopy and cut the muscle at the junction of the food pipe and stomach. So the past 10 to 15 years, because of evolution of technology in gastroenterology, a new procedure called POEM, which is an acronym for peroral endoscopic myotomy, wherein we do endoscopy and through the endoscopy itself we cut the lining of the food pipe and then we enter inside and create a tunnel. We dissect the structures inside the esophagus, food pipe, and then reach the junction of the food pipe and stomach. We cut the muscles in that area and then we come back and close the defect which we have created. So this is entire procedure is done by endoscopy only. So this procedure is a cutting edge technology in medical gastroenterology. The results are very dramatic. It's far superior than previous procedures like dilatation, and it's a very safe procedure. The outcome is almost very good in all the types of Achalasia cardia. So the hospitalization duration is also very less. So this patient, actually I have done this procedure in a very short time. So around 30 to 40 minutes I have finished the procedure. It is done in general anesthesia and then the patient is discharged the next day morning. So we do a small contrast study. We ask them to swallow a liquid and then do a X-ray of the chest, and then if it's fine, then we discharge them. So the entire procedure is done and the hospitalization is less than 24 hours. So as compared to surgery, which may require 2 to 3 days of hospital stay, and the cost of procedure also is significantly less than surgical cost. So this procedure was managed by this POEM procedure, and she has come for review now after 2 weeks time, and she is doing perfectly fine. She has no symptoms of difficulty in swallowing and she is doing perfectly fine.